Good morning, I'm Lacey Nobles. Our news conference will start in just a few seconds. Welcome to the City of Lubbock COVID-19 news conference. We have a lot of information to get to today. So today's panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Dr. Lawrence Skubinek, President of Texas Tech University, Kathy Rollo, Superintendent of Lubbock ISD, Michelle McCord, Superintendent of Friendship ISD, Keith Bryant, Superintendent of Lubbock Cooper ISD, and Lubbock Mayor Dan Pope. So let's start with Catherine Wells.
Good morning, everyone. I thought we would start off today's newscast with some good news. Over the last week, we've actually recorded a decrease in our overall case counts. I hope we can continue this trend. This is good for our hospitals, our economy, and most importantly, the health of our community. However, we are still reporting close to double the weekly cases that we were reporting in early October. Just to put that in perspective, the week of October 4th, we reported 1,163 cases, and that's compared to 2,658 cases that were reported in November, or the week of November 30th. Although our cases have subsided a bit, we need to continue with our prevention efforts. Each week, we are getting new tools in our toolbox to fight this virus. We have data that shows that masking slows the spread. We have antibody treatments available, more testing resources, and now we're talking about vaccines. However, none of these interventions are 100% perfect. And it's going to be a long time before we can get back to a time where we can just drop those two key public health messages. That first one is maintaining that distance and limiting those gatherings. And then the second one of wearing that all-important mask. With that, I'm going to turn things over to Dr. Cook, where he can talk a little bit more about our vaccines and new treatments.
Thank you, Catherine. And it is a beautiful day outside, but what I want you to hear two things. We're not out of the woods yet, but we have good news on the front. We can see light at the end of the tunnel. Our hospitals remain full, as Catherine said. We had 9 patients last night that didn't have a bed in our hospitals. They were in the emergency room. They were admitted to the floor or the ICU, but they didn't have a bed because the floors in the hospital and the ICUs are full. We must continue to fight the fight. We must continue this marathon. Our test rates are still high. Our positive rate is still very high. And I know that the CDC has come out with some new guidelines, but their primary guideline shows that we must continue to quarantine for 14 days. I do not recommend at this time that we change our quarantine requirements. We must continue the course. We're not out of the woods. We're getting closer, but we're not out of the woods. Now for the good news. As you have heard on the news today, that a woman in the UK received the first dose of the vaccine. Our vaccine is on its way, and maybe as early as the first part of next week. The Federal Drug Administration meets day after tomorrow on Thursday, and within 48 hours of their approval, I think they meet for about 3 days, but 48 hours of their approval will be shipped our vaccine. It'll be directly shipped from Pfizer to us. Those first doses will go to frontline workers and those that are highest risk. The news about this drug, and just more information that was released today, is that it's at least 94 to 95% effective. No other vaccine in our history has been able to achieve that kind of efficacy or the efficiency at which it makes us immune to the virus. The science behind this vaccine is sound. You will have to get 2 vaccines or 2 doses of the vaccines in about 3 weeks after that. So Pfizer's vaccine is 2 injections. They're about 3 weeks apart. The Moderna vaccine is 4 weeks apart between their injections. And then you need an additional 10 to 14 days past the second vaccine to have full immunity to the virus. All that to say is that we can't stop. Just because you get the vaccine doesn't mean you have to stop wearing your mask and physically distancing. And I say I'm changing to physically distancing because you can still be social and be physically distant at an appropriate space and distance between the two. So let's use physical distancing because we can still be social. It's going to take about 80% of the population to be vaccinated before we reach herd immunity. The good news is the vaccine's coming. It works, looks like it works very well, and it is very safe. And again, the other good news is we have the antibody drugs here, the bamlanivimab and Regeneron. Those two drugs are being infused as we speak. And if you're a candidate, and let me run over those criteria to being a candidate, is that your age is greater than 65, sometimes less than that, 55, or even if you have other things like uncontrolled diabetes, hypertension, lung disease like emphysema or COPD, that you're immunocompromised either from a disease process and you're taking a drug that suppresses your immune system, and or you are in the middle of chemotherapy treatment for some kind of cancer, you have chronic kidney disease, or your BMI is greater than 35. You don't have to meet all of those, but some of those will get you in as a candidate for the infusion process of the antibody drugs. If you feel that you're a candidate, please let your primary care provider know, your physician or your other provider know that you would like and you're interested in having that infusion. Later this week, we'll have up on the city's website a link where your provider can import the information directly into a database, and then the infusion centers can pull that information out and contact you. All that to say is we must slow down the virus. We're not out of the woods. We can see the light between the trees now. This is good news. We must continue to wear a mask. We must continue to physically distance. We can still socialize, stay in small groups, and wash your hands. That's all that I have. Nothing shows that you care more for others than wearing a mask and physically distancing. Thank you. Let me hand this off to Dr. Skovanec.
Guys, it's not working. What's going on here? 1 second, please. Okay, thank you, Dr. Cook. I'd like to begin by expressing on behalf of all of the Texas Tech community our appreciation for what our healthcare providers have done and continue to do, and also to the leadership of the city and how they have helped us navigate this unusual semester. As of yesterday, we had 174 active cases at Texas Tech. That's one of the lowest numbers we've had for several weeks. Last week, we had 105 new cases, but almost 3 times as many recoveries. So those are good trends. In terms, I think, of what we've learned this semester is that the classroom can be a safe environment. Our enrollment for next spring is projected to be about 3% greater than it was a year ago. But what is of concern is that the retention of our first-year students is down a few percentage points. I think that speaks to the fact that this has been a challenging transition for those new students and the need to have face-to-face instruction. As of our current schedule, next spring, we'll be offering 41% face-to-face, 28% hybrid, and 31% online. And we'll make every effort to make sure we can make this as normal a college experience as we can. A couple of things I should mention that may be of interest to the community is we will be having an in-person commencement ceremonies this weekend. We're also providing a virtual commencement ceremony the following week. We'll be having 8 ceremonies. The number of graduates at those ceremonies will range from less than 90 to less than 290. The graduates are allowed to have 4 guests, so total attendance at these events will range from less than 300 to about 1,100. There are many protocols that have put in place to make this as safe as possible. There will be no procession, for instance, as they enter. Students will merely come in and make sure that they're socially distanced. Everybody in attendance will have to wear a mask. We'll be providing masks and hand sanitizers to everybody in attendance. There'll be no speakers, and graduates will proceed across the stage. Their degrees will be announced and their honors, and a photograph will be taken, and then they'll immediately leave. As for basketball, we think this has gone fairly well. We have noticed, though, that in the most recent games, that we have to be very diligent in making sure that our protocols are being followed. We have a 3-step process. We provide a mask, ask people to wear a mask. The second visit may issue a warning, and ultimately one could lose their ticket privileges. But we've been fairly pleased with the compliance, but we have to be diligent in making sure we continue to make sure that's the case. And that's all I really have to say at this point, and I'll turn it over to Dr. Rollo.
Good morning. First, I just want to say how incredibly grateful I am that Lubbock ISD is the largest district in the state of Texas that started school when we said we were going to on August 17th. And it's hard to believe that we are almost to the first semester end. But we've had a great year. We started our year with about 30% of our students in our virtual school. That percentage has decreased with each 9-week grading period. And when we come back after the holidays, we'll be just below 20% of our students in virtual school. We will continue to offer virtual school for the rest of the year, and we've made improvements throughout the year as we have proceeded in virtual school because we want this to be a high quality option for families. We've also learned about the importance of testing. Our Lubbock ISD team has put together a rapid testing clinic, and testing has been available since October 30th for all of our staff members, symptomatic or asymptomatic, and it's been great to have this availability so that we can identify positive cases quickly and help keep from spreading the virus. We've tested about 800 of our staff members, and we are going to expand that testing after the holidays to students as well, with parent permission, of course. We've learned the importance of communication, and in an effort to be more transparent, we set up our own Lubbock ISD dashboard that is available to anyone in the community to see which campuses have the number of active cases plus the number of recoveries. And we feel like that's been a great tool to help keep the community informed of cases. I am just so proud of our students and staff for staying diligent with our safety protocols. Similar to what Catherine Wells shared, our numbers since the Thanksgiving holiday have decreased since before the holiday. We believe the Thanksgiving break gave us a chance to deep clean, and our people came back and are very diligent about following protocols. School has been great. It looks different. One example of that is normally during this time of the year, we have lots of student performances. They come by central office and perform for us. We're still doing that, but we're doing it outside in our central office courtyard. We also have the opportunity to I had the opportunity yesterday to actually watch how automatic our safety protocols have become for students. I was watching our Coronado High School color guard, and without being told by the staff, as soon as they finished their practice, they sanitized their flags. So it's been a great year. It's been a challenging year for educators. So I just want to say thank you to all of our teachers. We've asked you to go above and beyond, and you have done that. That is all I have. We are grateful to our community for supporting both our virtual and our face-to-face option for students. And with that, I will turn it over to my friend and colleague, Dr. Michelle McCord.
Thank you, Kathy. I'll try to touch on things that are different that haven't been mentioned, but I think that in terms of lessons learned, I would say what comes to mind is all the things that Dr. Skuvenek and Dr. Rollo have mentioned, but I would say the word that comes to my mind is just cooperation. We could not have done this. It's hard to believe that I think we're in our 15th week of school, and the kids are wearing masks, age 10 and up. Our staff wears masks. Our parents have been cooperative. The community has been great. We've worked together in typical West Texas fashion. But I would say, kind of as I reflect on the semester that we're closing on December 18th, is that, of course, we all know that school is an academic institution. But I think last spring and this school year, we've been reminded that public education is a huge social service institution as well. And one of the things that we're still learning is how do we effectively provide social services to our virtual learners, whether you're long-term or you're quarantined, and also just the needs that are unprecedented, the mental health needs. People are depressed, people are anxious, our staff, our kids. So just addressing those needs, being responsive. And so a quick story about one of the things that I've learned is, I guess we just didn't think about it when we started virtual learning, that our virtual learners and their families really want to be connected and stay connected with the school. So one of the things that came up was I got an email from a parent that said, we're not getting, our school t-shirts. I didn't see an order form for that. Or when are school pictures? So what we found is that our communication with parents was, for elementary in particular, was going home in what we call a Tuesday folder. That just means it's a folder that goes home on Tuesday. So we created a virtual a folder for virtual learners. And so it's been great. They have come on picture day. Sometimes we create a safe environment for that. So we've tried to be more purposeful in making sure that we're including virtual learners, not just in the academic piece, but the social piece as much as possible. We've learned that our mitigation measures are working. Just like Catherine and Kathy have mentioned previously, we're seeing a decline in cases, but we're not taking that for granted. We do have to remind kids and adults, just like we need to be reminded of the rules when we're not in a pandemic. We just have to be reminded, but people are for the most part, very compliant. The thing that I would say that's new and different, maybe as we look forward, is that we're going to continue with Friendship ISD. We're planning to continue with the virtual learning option for the remainder of the school year. However, this year has been one of the most humbling experiences I've ever been through. So our plan is to keep virtual learning, long-term virtual learning in place for the rest of the year, but who knows? That's our plan today. I do want to let you know that we're planning to continue the virtual option, but TEA, so the Texas Education Agency, they broadened our authority recently. And so, as most of you know, if you've been hearing, some virtual learners are not being successful at home. We're trying, they're trying, but it really is just a new system. And so TEA has allowed that even if a school district continue as a virtual learning option, that we can cancel the virtual learning for a student if they've shown that they cannot be successful. They have failing grades, they have poor attendance. And now, of course, if you have a medical exemption, then that would be another story. But we've got to help kids be successful in their learning. The other thing that I would say is that with indoor extracurricular, so we've been having indoor extracurricular events since August with volleyball. So now we're in basketball season, and we just have to continue with following the UIL guidelines, following the governor's mask mandate. What's different for us when it comes to making sure that we're following, being diligent about, kind of like Dr. Skuvenek mentioned, sometimes people forget, they get passionate about the game and they forget. So we have extra administrators on duty, and we remind people. It's easier to remind the kids. It's harder to remind the opposing team when you don't know those adults and you don't know the kids. But we like to remind them and give them chances to follow the rules. We limit the capacity, limit the number of tickets. So like everyone else has said, I'm so grateful to live in this community. We've had such support from everyone, but we just can't let our guard down now. When we start back in January, we're going to be prepared for whatever we need to do. And with that, I'm going to pass it on to my friend and colleague, Superintendent of the Year for the state of Texas this past year, Mr. Keith Bright.
Well, good morning, everyone. Thank you, Michelle. And I don't have a whole lot to add to what Dr. McCord and Dr. Rollo shared, but I will tell you the thing that I've learned the most through this, and I think many parents would agree with this, and that is it's hard to find a person that's more important in a child's life outside of the immediate family than a teacher. And that's become so evident over the last 9 months. When we all walked out the door for spring break, what we thought was going to be a week off, and then we turned around a day later and worked 7 straight days trying to get everything ready to shift what everybody knew public education to be to something we never envisioned education becoming, and that is a complete virtual online school for the remainder of the year. There was a lot of expression made to me by community members of the importance of teachers and how much they missed their kids being in school. And so we started this year, much like Dr. Rollo and Dr. McCord, we started on time when we planned to start with a lot of protocols in place. You're well aware of those. But our teachers have done extraordinary work. I can't emphasize that enough. Certainly our healthcare professionals, nurses, doctors, those on the front lines deserve great credit and great praise for what they're doing in our community. But right behind them, really, our teachers deserve extraordinary kudos for the job they're doing. They have taken kids who in our situation have been, we had a philosophy that we might have to separate our kids with virtual instruction, but we weren't going to isolate them. So we've taken it upon ourselves in our district, as well as other districts, I'm sure, to make sure kids don't feel isolated. And our teachers have been on the front lines of doing that. So I want to publicly say to all the teachers in this area, not only in Lubbock Cooper and Lubbock ISD, Friendship ISD, but all the districts around, thank you for the work our teachers are doing every day. They've set aside their own personal beliefs or agendas or whatever they may be, just to make sure kids have a quality education. And, you know, we found through this also how much social interaction matters to children. The younger they are, the more important it is. Virtual learning, while it's necessary during these times, has really been a challenge for the younger kids because they crave that social interaction. And in our district, we ended the virtual learning component as a whole back in the middle of October. Now we still have it for those that are medically fragile, those that are quarantined, and those that are sick, but the widespread part we ended. And the thing about that was for us, not speaking for any other district, but for us, is our kids were really struggling academically, but they're also struggling emotionally and socially. And so we put our protocols in place, brought kids back. It's been very successful. We also, much like Lubbock ISD, we've begun testing teachers. We've tested a couple hundred teachers over the past few weeks that we've implemented that program. The state allowed us to do through the Texas Education Agency. And the neat thing about the teacher testing, the rapid testing that we've been able to do is when a person comes in, they're not feeling well, but they're not sure they have COVID. If they go get tested elsewhere, might have to wait 2 or 3 days. And if they come test with us and they are negative, then they can return to the classroom as long as they haven't been exposed. And that has enabled education to continue. It's enabled us to have enough adults in the classroom and in the school buildings to take care of our kids. Finally, much like Dr. McCord shared with extracurriculars, be it band concerts, theater productions, indoor basketball games, we have, in the spirit of cooperation with the city and the community trying to lessen the spread, we've implemented a number of changes to reduce our crowds to immediate family only, with the requirement that folks wear facial coverings while they're in our facilities as well. And we're just trying to do our part in the community to, along with everyone else, to try to make sure we can continue to have school. We can continue to have these extracurricular activities to allow kids to be involved, because we know the more involved kids are, the less likely they are to get into trouble outside of school. And so extracurricular activities, not just sports, but all activities, the fine arts, the agricultural programs, the other leadership programs, it's so important in this day and age to make sure kids are involved with a purpose. So thank you for the opportunity to be with you today. And with that, I'm going to turn it over to Mayor Dan Pope.
Thank you, Keith. Good morning, everyone. It's great to be with you today. I want to start by sharing my screen and doing our data slides real quick, so bear with me for one moment. Okay, let me back up the other direction here. Bear with me a second. Okay. All right. So our average positivity rate has ticked up this week as we are doing fewer tests. You can see the results of that. I think probably we saw a spike in testing as college students prepared to leave Lubbock and go home, and many of those were encouraged to test. But you can see this positivity rate. Well, some of this is still skewed a bit by the Thanksgiving holiday. We'll pull some of that'll roll off next week. We'll probably have a little better data set for the 2 weeks. This may be the most encouraging slide of the day. Hospitalized patients. You can see that this number has come down significantly. In fact, on Sunday of this week, we had 272 hospitalized patients total in the community. A week before that, we'd had 360. Now, that doesn't mean that our hospitals aren't under a lot of stress. I'll talk more about that. The ICUs are still very, you can see the ICU, the orange, that would be the ICU patients. That number has remained virtually unchanged over the last 2 or 3 weeks. I think peaking at a little more than 100 and really settling in the mid 80s for most of that time. Case count by age over the last 14 days, you can still see that the 18 to 25 year group is contributing the most. All that's down a little bit over the last week. See those numbers. And then finally, the hospital bed number. This is what Dr. Cook alluded to earlier. I mentioned a few minutes ago, these would be COVID eligible beds that could take a COVID patient. And once again, last night we had patients waiting for beds that we did not have. Okay. So I want to start by thanking the leaders that you just heard from Texas Tech, from our school districts. I was considering my comments earlier today, and I realized that next week we'll have been doing press conferences related to this pandemic for 9 months. This is not the first time you've seen Dr. Skuvenek or Dr. McCord or Rollo or Mr. Bryant join us. And not only do they join the press conferences, but they're very much active in what we're doing, and we rely on them for their leadership and their collaboration. So I'm thankful for that. I also think it's important that we pause and just provide, I provide a word of empathy and sympathy for the families that have been impacted with losing loved ones to COVID-19. Also to those of you that have lost your jobs and your businesses, that's never lost on city leadership. I think that although things are better in our hospitals, it's important to remember that we're relying on more than 150 healthcare workers that don't live in Lubbock to help us today. They're helping us provide services. We talked about people still waiting on beds. I think it's also critical that we think about those workers, our workers that are on the front line and have been for 9 months. So all of our efforts are not only in part, but are all focused on trying to lessen the impact that this is having on our hospitals. So I have 4 or 5 real quick things I want you to think about. Please remember, our decisions, our policies are made on facts, on data, and on science. They're not based upon fear. The antibody drugs are working. The Eli Lilly drug and the Regeneron drugs, they are for people that are not in the hospital. They're to keep people out of the hospital, and they're working. So that's good news. The vaccines will ship later this week, and Lubbock residents, Lubbock frontline workers will be vaccinated next week. We've been waiting for that. That's really good news. That vaccine is safe and it's effective. So like you, we're tired. But I think we need to realize that public health measures are not the enemy. Instead, they're a roadmap to a faster and more sustainable recovery. Finally, we all share personal responsibility to slow the spread of COVID. We know that things like wearing a mask and socially distancing work. Please, let's do this together. Stay safe, be hopeful, and be kind. Lacey, back to you.
Thank you, Mayor, and thank you to all of our panelists. I'd like to ask all of you to turn your cameras on as we open it up for media questions. In respect for time, we're trying to keep this right at an hour. Media partners will only get to ask 1 question to 1 panelist. I will be muting you after you ask your question. Today's media order is El Editor, KMAC, Fox 34, the Lubbock Avalanche Journal, Texas Tech Public Media, Latino Lubbock, KCBD, and KLBK. So today we start with Olga Aguero with El Editor.
Buenos dias. Good afternoon. It's awesome to see all of y'all. All of y'all's participation and efforts and time is greatly appreciated. May God bless y'all for that. I would like to start this by asking Kathy Rollo and the other superintendents if they can just push in or just say a few words about it, if they can, if Lacey will let them. Okay, Ms. Rollo, since Dr. Dan Cook touched on vaccines, the distribution of them, how are we going to make the vaccine accessible to teachers and students and family with compromised immune systems? Is it income-based? Teachers on the lower scale, will they need to show documentation? Could you tell us a little bit of?
Olga, I don't know a lot about vaccine availability for educators as far as a timeline. I do know that educators are on a timeline, or not on a timeline, but they are considered in part of the first phase, but it will be after the healthcare workers. As far as the district being responsible for vaccinating, we have not received any guidance from TEA on that at this time.
Okay, we'll just keep it to Dr. Rollo for right now, just so we have time to get to everyone's questions. Next, we're going to move on to Matthew Stell with KMAC News.
Thanks, Lacey. My question is for Catherine Wells. Catherine, I heard you say that our numbers have slightly been going down since the Thanksgiving holiday. Is it safe to say that if people gathered for the holiday, that they actually kept it small, social distance, or just played it safe this holiday, which is a good thing? Is it safe to say that?
I don't think we're quite there yet. It still takes about 2 weeks before we see a spike associated with the holidays. I'm hopeful, and I hope people followed public health guidance, but we still need to be monitoring and following those guidelines as we enter the Christmas season.
Okay, thank you, Matthew. Now we have Chelsea Collinsworth with Fox 34.
Good afternoon. How are y'all? So my question is for Dr. Cook. So you talked a little bit earlier about certain criteria that patients need to meet in order to receive the antibody treatment. For maybe people that don't meet that criteria, what's being recommended for them to potentially keep those patients out of the hospital? And if we continue to see our hospital capacity remaining full, could we possibly see any more medical tents in our area?
Those are good questions, Chelsea. For right now, the highest risk individuals, the ones that if they have a high likelihood of being hospitalized. So the whole purpose of giving the antibody drugs is to make sure to do our best to keep them out of the hospital. Other individuals that don't meet those criteria are relatively low risk. You may feel terrible, you may have a cough, you may have all the fatigue, the high fevers that last a week or more, but the likelihood of you going to the hospital is much lower than those individuals that meet those criteria that I listed out. And so the most important thing there is to stay hydrated, stay away from people, keep yourself isolated, those sorts of things. Those are the things that we have right now to treat those. We don't have a good drug other than those sort of things that we've already mentioned to try to stop it until we can get the vaccine distributed. But the antibody drugs, the bamlanivimab and the Regeneron antibody cocktail, are for those individuals that meet those criteria.
Okay, thank you, Chelsea. Thank you, Dr. Cook. Now we move on to Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone. Dr. Rollo, I'd like to ask you this question simply because Lubbock ISD has the highest number of online learners. So I guess with the semester wrapping up, do you feel like online learners fell behind any more than students that were taking in-person classes? And can you talk a bit about, with vaccines on the way, what are you looking for? What's going to be kind of the trigger to bring all the students back into classrooms?
So with regard to online learners, when we look at our overall grades of our online learners compared to our face-to-face, overall, our face-to-face students are outperforming our online learners. However, there are some students who are doing extremely well with online learning. And so it really is an individual case-to-case basis. As far as bringing all students back, we are hearing from our parents that there are multiple families that are just not comfortable sending their child to school face-to-face. And so we want to make sure we can continue to serve those students. So we are committed to continuing online learning, virtual learning through the end of the school year. Just like Dr. McCord shared, we do have a provision now with TEA that if a student is failing one or more classes in virtual school, we can require those students to come back with meeting with parents. So that is something that Lubbock ISD is doing as well.
Okay, now we have Sarah Self-Walbrick with Texas Tech Public Media.
Hello, everybody. My question is also for Dr. Cook about hospitalizations. And we've touched on this. A couple of different panelists have touched on this. The number of hospitalizations have dipped a little bit over the weekend, but judging by the dashboard, staffed beds still seem to be a bit of an issue. Do we know why that hospitalization rate dipped so much over the weekend, though? What is keeping these folks out of the hospital?
So that ratio or that percentage number is actually the number of beds in the hospital available divided, or the number of COVID patients divided by the total number of beds in the BRAC area. So that's not just Lubbock, that includes some other counties or some other hospitals in the region, their numbers as well. So it's hard to say. It could be just a little of the undulation that we always see occur. It's a hopeful sign. And the only way it will remain hopeful is if we consistently decrease that number over time. So it's too early to tell. We're still too close to Thanksgiving, the week it takes for people to get infected, and then the week roughly that those people will be sick enough to be admitted to the hospital. We're still, as I said before, we're not out of the woods. I think we see some signs that give us some hope. But we'll just have to continue to watch it. And everybody has to continue to do their physical distancing and mask wearing, small groups, washing hands, all those sorts of things.
Okay, thank you, Sarah. Now we move on to Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. It's great to see you all, and kudos to all the school districts. No doubt that today's theme from the school districts is lessons learned. That being said, I think it's important to remind of a couple of words that I've heard specifically from Catherine Wells: cautiously optimistic. So with that, I don't know if Dr. Cook or the mayor or Catherine want to respond to this, but lessons learned. How are we now preparing for the Thanksgiving surge while we're maintaining that cautious optimism that the numbers have gone down? Because we know they're going to go back up. We don't want people to get too lax. So what are we doing to prepare for that surge? Lessons learned.
Thanks, Christy. You know, we're just going to continue to do what we're doing. We have the staff right now. We're running the red line, but continue just doing what we're doing. In our constant message is that we can't let off the gas pedal. We can't let up now. We still must do all those things to prevent hospitalizations. And we know what those are. Those are those physical barriers that we have that I know that you can quote: the physical distancing, the hand washing, the face masks, and all the people that you see here on the panel are pushing that same message. We must continue to do that. Right now, we don't have any more resources. There are other populations, other municipalities in the state that are meeting those, that need those materials and staff. And so I think we have what we're going to get, and we must continue to encourage people to do those things to keep people out of the hospital.
I would add to that, Christy, that we've not necessarily seen a spike after every holiday this year. So it's if you if you start with sort of start with Mother's Day and move forward as we've looked at this. So we do remain cautiously optimistic about Thanksgiving. I think a lot of people did Thanksgiving very differently. Maybe most important, we are working on further contingency plans with the state and with our hospitals. So if we did see a spike, that we would be prepared to address it.
Okay, now we move to Karen McKay with KCBD.
Good morning. Last week at the news conference, we heard that there were meetings going on that day to determine how you will prioritize the frontline workers, the nursing homes, all those who need to be first in line to get the vaccine. So I'm wondering now, what have you decided and how will you prioritize that lineup, especially if that first batch is a limited supply next week.
Thank you, Karen. So the phase 1 people, then that includes high-risk workers, first responders, those individuals. So as those allotments of vaccine come in, it's up to each hospital, each entity to decide who in their group gets that vaccine first. Now, as a health authority, it's not me to decide. Each hospital, each other entity, the health sciences center, et cetera, have a priority list that they will give who they will give their allotment of the vaccine to. So it's up to each one of those entities to decide who in their, so phase 1, like I said, are high-risk health workers, first responders. That's phase 1A, and those people will be immunized first. And so we'll go from there.
I think it is fair to say, Dr. Cook, and correct me if I'm wrong, but with the vaccines that we'll get our very first shipment, there won't be enough to address anything other than just healthcare workers. Isn't that accurate?
Correct.
Okay, now we have Terry Furman with KLBK.
Hello, everybody. I think my question is probably for Dr. Cook and Ms. Wells. I've had a lot of people asking about the vaccine itself. Now, we don't know how it works on women that are pregnant. We've heard the rumors about it possibly sterilizing the younger generation. But what about those people who have, say, Parkinson's or some underlying condition that we didn't test the vaccine on? What are we looking at? How long it's going to take to figure that out?
As Terry, is with any vaccine that comes out and a new drug that comes out, there's close monitoring of all those individuals, and there's adverse drug reactions that everybody must report, especially with this vaccine. Now, the idea that it causes sterility, that sort of stuff, there's no evidence that it does that. It does not mix with your DNA. It doesn't create, as I said last week, COVID zombies. It doesn't do that. That's not the way it works, and it doesn't make you sterile. As with any vaccine population that's receiving a new drug, that sort of thing, inevitably there are going to be pregnant people that somehow get the vaccine that didn't know they were pregnant, and that occurs. Currently, there's not a big study that shows that, but the preliminary data show that it doesn't cause any effect. Now, they did not specifically create a patient population that's pregnant to test the drug on. That's not what we would normally do. We'd test it on otherwise normal individuals. But you can imagine as we vaccinate the masses, there are going to be people in there that are pregnant, that didn't know they were pregnant. And so we'll just have to wait and see. But there is absolutely no evidence that this creates COVID zombies or hurts the fetus or the baby or children or causes sterility or any other thing like that. We need to put that away, period.
Okay, and that's all of our media questions today, and this concludes our news conference. I want to thank you to our interpreter and thank you to all of our panelists for offering their very important insight today. Remember, all this information can be found on our COVID-19 dashboard at mylubbock.us/COVID-19. Have a good week.